Hello and welcome to this Friday weekly webinar. Today to talk about role of yoga in gynecological disorders, we have with us Dr. Lavi Sindhu ma'am, who is consultant and clinical in charge at Medicover Fertility, Delhi NCR. I heartily welcome you ma'am. आपका बहुत बहुत स्वागत है. We also have with us Communication and Documentation Officer of Morarji Desai National Institute of Yoga, Mohammad Tayyab Alam sir with us. आपका भी बहुत बहुत स्वागत है sir. Now, as per the parampara of our esteemed institute, we will start the program with prayer. Om Sahana Vavatu Sahano Bhunaktu Sahaviryam Karvavahai Tejasvinavadhitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. Morarji Desai National Institute of Yoga conducts Friday webinar on each Friday by inviting eminent scholars from various fields. Today to talk about health, role of yoga in gynecological disorders, we have with us Dr. Lavi Sindhu ma'am, who is IVF consultant at Medicover Fertility, Panchsheel Park and clinical in charge Delhi NCR. I heartily welcome you ma'am. आपका पुनः एक बार बहुत बहुत स्वागत है.
Thank you so much. I am privileged to be here.
We also have Communication and Documentation Officer of MDNAY, Mohammad Tayyab Alam sir with us. आपका भी पुनः बहुत बहुत स्वागत है sir.
Thank you, Dr. Vandana.
Now, without any further delay, I would like to invite Mohammad Tayyab Alam sir for further proceedings. Sir, over to you.
Thank you, Dr. Vandana. Before coming to the today's esteemed guest, I would like to say a few words about our Friday webinar. Friday webinar is one of the important activities of Morarji Desai Institute of Yoga. Eminent experts of yoga, modern medicine, allied science, diet and nutrition, media, and from many other disciplines are being invited for this prestigious Friday webinar. Dr. Iswarvi Basavareddy, Director, Morarji Desai Institute of Yoga, is the motivating force behind successful organization of this Friday webinar. It is because of Director Sir's vision the Friday webinar has completed its 1 year in October 2021. Now for the guest, today we have with us respected Dr. Lavi Sindhu ma'am, MBBS, MD Gynecology, consultant and a clinical in charge at Medicover Fertility Delhi NCR. Welcome you ma'am in our Friday webinar. Dr. Lavi Sindhu ma'am has done her MBBS Vardhaman Mahavir Medical College and the Safdarjung Hospital Delhi, and a MS Gold Medalist of Obstetrics and Gynecology, Vardhaman Mahavir Medical College and the Safdarjung Hospital Delhi. About Safdarjung Hospital Delhi, I think everybody, not only in India, in fact in the entire world, know about the importance and what the work Safdarjung Hospital is doing for the mankind. Ma'am is also DNB Obstetrics and Gynecology, Diploma in Infertility and Clinical ERT, Indian Fertility Society. Ma'am has attended many conferences in infertility and endoscopy and work as a member of research teams in various studies. She has many publications to her credits and has been an active member of various societies related to gynae and infertility. Her field of interest are infertility, recurrent implantation, failure, endometriosis, and adenomyosis. Today, ma'am will speak upon the role of yoga in gynecological disorder. The topic is extremely relevant for students, yoga practitioners, and faculty, as it highlights the significance of yoga in perspective of modern science. With these few words, I request respected Dr. Lavi Sindhu ma'am for the lecture. Ma'am.
Thank you so much for the kind introduction, and I'm really honored to be a part of this wonderful program which you people are doing for the welfare of the society, to educate and to inculcate the practice of yoga into our modern generation. And definitely it is a very good combination of yoga and science, which helps in relieving and alleviating lot of problems in adolescent age group and gynecological disorders. So I'll be talking about the role of yoga in gynecological disorders. So shall I start sharing my PPT?
Yes, ma'am, please.
So is it visible?
Ma'am, whole folder is visible, not your PPT.
Okay. So I'll again is it okay?
Kindly click to the PPT. It will be visible.
Okay. Is it visible now?
Ma'am, it is visible, but the entire PPT, entire slides are, we can see here.
Okay.
If you don't mind, is it possible to share the slides to our IT expert?
Yes, I have already shared the slides.
Rishi, please, Rishi, please, you start showing the slides. Yeah, now it is visible, ma'am.
Okay. So I'll start with my presentation. So as you all are aware about yes. So as you all are aware about that, yoga, the word is derived from the Sanskrit word yuj, which means to join or unite together. It is a method of learning. I think there is some problem with the visibility.
No, it is visible, ma'am. You go ahead.
Okay, but it's not visible to me. So, yoga is a method of learning that aims to balance the mind, body and the spirit. It was developed as a part of tantric civilization more than 10,000 years ago. And it is not a process, it is a lifestyle. It works on all aspects of a person, whether it is physical, mental, emotional, intellectual and spiritual. So it is the science of development of a person's consciousness. Evidences show that the history of yoga is related to Indus Valley civilization, which dates to 300 to 1300 BC. It is also mentioned mentioned in Upanishads, Mahabharata and Ramayana. Maharishi Patanjali gave Yoga Sutra around 147 BC, and history of yoga is as old as Indian history. So I'll just quickly do this, that it is an Indian heritage and it is divided into 8 periods: the pre-Vedic, Vedic, Upanishadic, Epic, Sutra, Smriti, medieval and the modern period of yoga. At the 69th session of the UN General Assembly in New York, the Prime Minister of India urged the need to celebrate the International Yoga Day for the harmony and peace in the world. And the 21st June was declared as International Yoga Day by the United Nations. And the first International Yoga Day was celebrated on 21st June 2015. How does yoga help basically? So it mainly improves, when we talk about the gynecological disorder, it mainly improves the reproductive functions by reducing the stress and balancing the neurohormonal profile. There is alteration in brain waves, basically an increase in the alpha waves and decrease in the serum cortisol level, which was observed during yoga therapy. And there are studies which shows the mechanism and the evidence also. Another way is it is related to other risk factors such as high blood pressure, lipid, oxidative stress, coagulation profile and immune status, and may also influence the metabolic profile of the individual. It mainly helps in improving the hormonal and biochemical changes related to HPO and HPA, hypothalamus pituitary ovarian axis and hypothalamus pituitary adrenal axis, which is a common problem in polycystic ovarian disease, which is a common condition in adolescent and reproductive age group. So these are the some ways through which yoga helps in improving the reproductive function, the menstrual disorders. This is a main schematic diagram representing the female hypothalamus gonadal axis. The hypothalamus, which is a part of the brain which release the GnRH hormone, and various stress, anxiety, lack of sleep, medications, alcohol, they have an impact on this hypothalamus, which disturbs the gonadotropin releasing hormones. The gonadotropin hormones act on the anterior pituitary, which further releases the LH and the FSH, which are the main gonadotropin hormones, and they further act on the female reproductive system, the uterus and the ovaries, which produces the hormones estrogen and progesterone. And these two hormones, they act on various physiological, psychological aspect of the female, and they also have a negative and positive feedback impact on the pituitary and hypothalamus. So this is a very important axis in the females, in the women, and which basically any alteration at this axis can cause various impact on the emotional, psychological and the reproductive structures, as well as various menstrual disorders. So these are the factors: stress, anxiety, lack of sleep, medication, alcohol and various other environmental factors which affects on this axis. And yoga helps basically by reducing these negative stressors impact, as well as causing an alteration in these HPO axis, which shows a good response in the correction of these disorders. So what are the common gynecological problems when we talk about in general? So there is a polycystic ovarian syndrome, which is common in young and adolescent age group as well as in the reproductive age group. We have various menstrual disorders, pelvic pain, infertility, uterine fibroids, pelvic organ prolapse and urinary incontinence. So these are some of the psychological benefits by which yoga helps in relieving these problems as well as other systemic issues. It improves the balance, it helps in sleeping, correcting the sleep disorders, it gives the peace in the mind, it balances the emotion and happiness, it maintains the calmness of nervous system, helps in relieving pain or even better tolerating the pain, gives the inner strength and relaxes the GI and respiratory as well as the musculoskeletal system. So now we'll discuss the common disorders in a little more detail. So the PCOS and or the ovulatory disorders, which are the common complaints in the adolescent and reproductive age group. And according to WHO, there are three kind of ovulatory disorders. One is hypogonadotrophic hypogonadism, which we were discussing that HPO axis is very important in maintaining the balance between the emotional, psychological and reproductive functions as well as menstrual functions. So this is one group. Another group, group 2, is the PCOS, abnormal BMI, obesities and endocrinopathies, which is the most common group. And among this, PCOS is the main chunk, which is basically around 85% of the female are affected in reproductive age group. If they have certain ovulatory disorders, so most of the time it is because of the PCOS or abnormal BMI. And group 3 is the premature ovarian insufficiency. So we'll discuss a bit about the PCOS. It is a polycystic ovarian syndrome and it affects the adolescent and reproductive age group female. It is characterized by menstrual irregularity. There could be delayed cycles, there could be heavy bleeding, there could be amenorrhea for 2 months or 3 months, features of hyperandrogenism, whether it is clinical features or it is lab values which are higher for androgens, and mostly it is associated with polycystic ovaries, which we can see on the ultrasound. What are the major complications or problems which are related to polycystic ovarian syndrome? It causes menstrual irregularities. As I have told that there could be delayed cycles, period could be missed for 2 months or 3 months, there could be heavy bleeding post that, there is defective ovulation, obesity, hirsutism, that is excessive growth of the hair over unwanted parts of other parts of the body like the face and other areas where hair are not supposed to grow. It could lead to difficulty in conception. There could be metabolic effects like diabetes, heart disease, hypertension, glucose intolerance in the later part of the years. So it has an impact on every age group, starting from the adolescent, then into the reproductive age group, and then producing the metabolic disorders in the advanced age group. So when we talk about the treatment, we have certain treatments in allopathy. First of all, there is advice to undergo lifestyle modification, which includes exercise for around 30 to 40 minutes, 5 days in a week. Weight reduction, minimum 10% of the weight reduction can help in a better way to reduce the morbidity associated with PCOS, and dietary modifications, which includes a high intake of protein and low intake of carbohydrate, fats and antioxidant intake. Then in allopathic, we have certain medications which helps in pain relief, which helps in regularity of cycles, which help in ovulation. And if there is associated glucose intolerance or hyperandrogenism, then there are medications to relieve those symptoms. When we talk about yoga, yoga has a very important role in relieving the metabolic effects, in relieving the hormonal imbalance, and maintaining an overall milieu which relieves the symptoms of PCOS, whether it is menstrual irregularity, whether it is an ovulation which causes infertility, or whether it is metabolic effects. So there are various asanas which helps in relieving the symptoms, and they maintain an overall milieu and overall hormonal balance and help in relieving the symptoms. So we have the evidence supporting this theory, and in 2020 there is a publication in Health, Science and Reproduction which states that impact of yoga and exercises on polycystic ovarian syndrome among adolescent schoolgirls in South India. So they evaluated this concept, and there were 204 adolescent girls which were taken, and half of them were taken as control, in which the yoga was not advised, and half of them were in the experimental group. And then their results were evaluated, and they found that yoga and exercise were beneficial in minimizing the PCOS risk, as reflected in the risk assessment score. And they say that more such interventions covering different schools could provide larger health benefits. So they clearly shows the benefit, and they have suggested that more such studies should be encouraged. Then I'll discuss about another common disorder, which is dysfunctional uterine bleeding or abnormal uterine bleeding. So menstrual cycle is a complex entity. It involves the balance between the central nervous system, the endocrine, and the reproductive system axis, that is hypothalamus, pituitary and ovaries. DUB is defined as a state of abnormal uterine bleeding without any clinical detectable organic, systemic or iatrogenic cause. It means there is no pathological finding, or there is no anatomical cause for the abnormality, but there is abnormal bleeding. So WHO, according to a multi-center survey report, that the prevalence of excessive menstrual bleeding, it ranged from 8 to 27% in different areas of the world. And the pathophysiology is related to the abnormality in the HPO axis, and the prostaglandins, they are thought to be the main culprit for the pathophysiology of dysmenorrhea as well in these patients, because the prostaglandins stimulate the myometrial contraction, causes ischemia and causes the painful bleeding as well as the heavy menstrual bleeding. And because of the disturbed HPO axis, also there is abnormal bleeding in this category. So there are various treatments for allopathy. Combined OCP pills can be given, the GnRH analogs, they can be given to reduce the impact of this disease. But certainly yoga has beneficial effect on both phases of the menstrual cycle, and bring back the physical and the psychological well-being by balancing the neuroendocrinal axis of the female. So Yog Nidra is reported to be beneficial in managing the psychological impact of menstrual disorders. There is a study supporting this theory also, which was published in 2018 in Journal of Midlife Health, in which they have evaluated the women of the age group of 20 to 40 years with primary DUB, and they randomly assigned into a yoga and non-yoga group. And they evaluated after 3 months of the yoga therapy, and they found that it positively impacts the outcome of DUB by reducing the perceived stress, anxiety, and improving the quality of sleep. And they further advise that large clinical trials should be done in this regard to further view the impact of the yoga on abnormal uterine bleeding. Another common complaints in the young age group is endometriosis and chronic pelvic pain, which is a very painful condition, and it has a lot of impact on the quality of life, on the work quality, the family, and basically it produces stress, anxiety, and it badly impacts the female reproductive functions. as well as it has a negative impact on the quality of life due to pain and other associated symptoms. So there was a study which was done to evaluate the role of yoga in relieving the pain associated with endometriosis, and they have compared in two groups, one with endometriosis with subjected to yoga and those who did not participate in a 8-week yoga intervention. And it was clearly evident, it was statistically significant that the degree of daily pain was significantly lower in the yoga practice group, and there was improvement in quality of life in this group who was suffering from endometriosis, and they have undergone the 8-week yoga intervention. Apart from that, menstrual irregularities, which is also again a common problem in age group, in adolescent and young age group, and normal menstrual cycle which range from 25 to 35 days, and according to a study there could be 14 to 25% of women who have irregular menstrual cycles. They could be shorter or longer cycles, they could be heavier or lighter than the normal, or there are associated features like abdominal cramps, pelvic pain, or pain radiating to thigh, which we call as a dysmenorrhea. So menstrual disorder is one of the most common problem in the adolescent and reproductive age group women, and it basically impact the quality of life as well, mood. It precipitate the anxiety and depression. It adversely impact the work efficiency and family environment of the women who are suffering from these kind of menstrual problems. And there is an evidence that yoga reduces the psychological conditions like stress, tension, depression and anxiety, and it also reduces the physiological problems like pain during menstruation and irregular periods. So there was a study which was done. The aim of the study was to evaluate the effect of yoga asanas in the management of pain during menstruation, and they taken 100 women. Out of these, 50 were subjected to the yoga sessions for a period of 3 months for 45 minutes every day, and another group, 50 women, they were not subjected to yoga intervention. They were given only medication, and at the end of the 3 months a questionnaire was given and visual analog scale was used to measure the pain severity among both the groups, and they found that yoga and relaxative techniques are better and beneficial therapy in the management of irregular menstruation and reducing the pain during menstruation. And they have supported they have supported that these techniques may be used as a supportive along with the conventional medication. Coming to another group of infertility and problems in conception, there is a major concern in reproductive age group, and which is a significant problem in today's scenario, and it nearly affects, it is an old figure of 8 to 10%, but now it definitely affects around 10 to 15% of the reproductive age group females. And yoga therapies help in improving the reproductive functions both in men and women by improving the overall integration of the physiological systems. Studies have shown that yoga therapy orchestrates fine-tuning and modulate the neuroendocrine axis. It mainly improves the reproductive functions by reducing stress and balancing the neurohormonal profile. It helps in reducing the catecholamines levels, aldosterone levels. It decreases the serum testosterone levels, LH levels, and increase in cortical excretion through the urine, which is an optimal profile for any female, and it gives a positive impact. Also, it causes an alteration in brain waves, which I have already said in introduction, that it increase in alpha waves and decrease the serum cortisol level, and which definitely helps in improving this neuroendocrine axis and helps in improving the chances of conception. So these are the various pauses, which obviously I am not the right person to teach, and in itself each asana is a detailed lecture to talk about. So I'm just elaborating and I'm enumerating these common asanas which can be helpful in case of maintaining the neuroendocrinal axis, in relieving the symptoms of menstrual irregularities, and in maintaining the hormonal milieu in PCOS, and relieving the features of relieving the infertility and improving the chance of conception. So it is pranayam, padmasan, makarasan, ardh subhashan, shalabhasan, bhujangasan, viprit salabhasan, and durasan. Apart from these gynecological disorders, there are other benefits of yoga too. It helps in improving the sleep, it lowers the blood pressure and the glucose level, it boosts the immunity, it increases the blood flow to various organs, which helps in basically relieving the dysmenorrhea and the menstrual irregularity and improving the GI system. It improves the flexibility in the body, which helps in relieving the pain, the pelvic pain and the chronic back pain. It helps in weight reduction, which basically relieves so many symptoms when there is a reduction in weight. It boosts the emotions, happiness. It builds the muscle strength, the pelvic floor muscle strength as well, which helps in relieving the urinary incontinence and pelvic organ prolapse symptoms in elderly age group, and it helps in strengthening the bones as well. So the yoga adds years to your life, and it adds life to your years. So by saying this, I would say that this is just the beginning, and there is a lot more to explore. And I would like to thank you, all of you, for inviting me here for this presentation. And I hope I have justified to my topic, and I have given some good inputs towards this topic. So thank you so much for the patience listening.
Thank you so much, ma'am. Our comment section of Facebook page of our institute is filled with comments and praises all over. Somebody has asked some questions. If you would like to.
Yes, sure.
Somebody has asked, could you please suggest lifestyle-related changes in menopause?
So when we go for the lifestyle changes in menopause, so first of all, the exercise or the yoga comes into play. Basically, by doing exercise and yoga, there are benefits which help in reduction of the weight, which strengthens the muscles, which strengthens the bone. Apart from the exercise and yoga, there are certain dietary modifications required, which includes lower intake of the fat, basically the oil or the fats we use in the food, moderate intake of carbohydrates, high intake of protein, dietary include foods which are rich in basically the calcium, iron and other minerals. And apart from that, basically reduction in weight, dietary changes, and adequate sleep, and the yoga and exercise makes a complete lifestyle modification package for the women, and it definitely helps in relieving the premenopausal symptoms. It helps in relieving the age-related gynecological disorders like the urinary incontinence, the pelvic organ prolapse, and other metabolic disease as well.
Okay, ma'am. Thank you. Somebody has asked if we could please suggest the same in the problem of excessive bleeding. If somebody is suffering from excessive bleeding.
So when a female is suffering from excessive bleeding, there are certain important things which we need to ask basically. First of all, age is an important criteria. So whether the female is of adolescent age group, whether it is of reproductive age group, and whether it is premenopausal age group. Then second thing comes, if there is any organic cause to this excessive bleeding, whether it is associated with hormonal imbalance, whether it is associated with any fibroid or polyp, or there in any other changes which are very common in premenopausal age group like endometrial hyperplasia or any hidden malignancy. So first of all, this is also important to exclude. And if there is no organic cause, if the female is not on any medications which are posing her to risk of these abnormal uterine bleeding, then definitely the yoga and the exercise may help in relieving the symptoms in a very good number of cases. So the other things, exclusion is very important, and then definitely the exercise which we were discussing, the yoga asanas which we were discussing, they will help in maintaining the neurohormonal axis. They will help in relieving the stress and anxiety, and which has an impact on this abnormal uterine bleeding of excessive bleeding, and it will help in lowering the prostaglandins levels as well. So then it can help in a better way.
Thank you so much, ma'am, for accepting our.
Vandana, एक क्वेश्चन मैं भी थैंक यू मैम फर्स्ट ऑफ ऑल सो वेरी वेरी थैंक्स फॉर वंडरफुल लेक्चर. बहुत बहुत समय के बाद हम कहते हैं कि मॉडर्न साइंस के एक्सपर्ट्स को हम बुलाए हैं. हाँ, और आपने बहुत अच्छा लेक्चर दिया है हमारे साधकों के लिए, हमारे स्टूडेंट्स के लिए, हमारे फैकल्टी के लिए. हमारे मोर देन 1000 स्टूडेंट्स होते हैं जो हमारे डिफरेंट प्लेटफॉर्म से जुड़ते हैं हमारे कहते हैं कि फ्राइडे वेबिनार को. एक क्वेश्चन मेरा ये था मैम, जो पीसीओडी है, पॉलीसिस्टिक ओवेरियन सिंड्रोम, उसमें कुछ ऐसे योगा पोस्चर जो आप बताएं जो दिस इज क्वाइट कॉमन these days, especially in the urban culture. कुछ ऐसे योगिक पोस्चर के बारे में आप बताएं तो that will actually be helpful. या कोई ऐसा डाइटरी पैटर्न जो उनको प्रिकॉशन लेनी चाहिए या जो उनको लेनी चाहिए, इसके बारे में कुछ बताएं आप.
So, am I audible?
Yes, ma'am. Yes.
Okay. So when we talk about the PCOS, obviously it is very common condition, and in clinics we come across like every out of 5 or 6 women, each one of the women is suffering from this problem, and many girls are coming up with these problems of menstrual irregularity, obesity, and features of hyperandrogenism. So when we talk about the management of this problem, so it is always starts with a lifestyle modification. So when we talk about the exercise, so exercise, there should be any aerobic exercise. It could be skipping, it could be cycling, it could be the Zumba, it could be the jogging for around 35 to 40 minutes, 5 days in a week. And it definitely has an impact on balancing the neurohormonal endocrine axis, and it helps in reduction of the weight. And even these women, if they can reduce 10% of their body weight, so it becomes a very important factor for them. It definitely helps in relieving the symptoms. Then another important thing is the dietary changes. So we encourage to take a high protein diet. For a vegetarian, it could be a diet including of pulses, paneer, soya beans, nuts, and for a non-vegetarian, it could include the eggs and other the non-vegetarian food, and intake of antioxidants. So antioxidants, they are very much present in basically the lycopene and other antioxidant. They are present in green vegetables, tomatoes, and apart from that, the vitamin D intake is very important in this condition, because there is a lot of evidence that these women are also deficient in vitamin D. So vitamin D intake is very important in these female regularly. And apart from that, low carbohydrate intake and low fatty intake. And when we talk about the yoga asanas, so any kind of yoga asanas basically, they help in relieving the stress, they help in relieving the anxiety, they help in relaxation. So this mechanism itself helps a lot in basically the relieving the abnormality of the neuro HPO axis, the neurohormonal axis. And there are certain specific asana also which I have talked about, like the pranayam, like the Daruasan, Ardha Shalabhasan, Makarasan. So these specific asanas, they help in maintaining this neurohormonal endocrine axis, and the holistically all 3-4 parameters, they can definitely help in relieving the symptoms associated with PCOS, and they can be advised depending on the severity as a complementary therapy or as an isolated therapy apart from the medication.
Thank you so much, ma'am. Sir, any other questions?
No. Thank you, ma'am. Thank you for wonderful explanation. And now over to Dr. Vandana.
Thank you so much, ma'am, for accepting our invitation and giving such an intriguing and informative lecture to our viewers. Thank you so much.
My pleasure.
I would also like to thank Communication and Documentation Officer of MDNIY, Mohammad Tayyab Alam sir, for his help and support, and our guiding force, Director of Morarji Desai National Institute of Yoga, Dr. I.V. Baswa Reddy sir, for his guidance and his energy. Because of his energy only, we are able to organize these kinds of programs. Thank you so much. Thank you, everyone. Thank you. I would also like to thank our technical team as well for their help and support, and all the viewers who have joined us today. Thank you so much. Now we will end the program with Shanti. सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्, मा कश्चित् दुःखभाग् भवेत्. ॐ शान्तिः शान्तिः शान्तिः. Thank you so much. Thank you, ma'am. Thank you, sir.
Thank you.